Hello, excited to be with you again. It's one of your nurses here from Unified Osce. To all our subscribers, we want to say a big thank you. You are the reason why we keep going. And for all the latest NMC UK nurses, hooray, congratulations. Yeah. Without wasting your time in this video, we want to have a quick look at end of life planning station. There's a previous upload on assessment for end of life. You can always have a look at that. At end of life in your planning station, you want to make sure you read your scenario to get to understand what the focus and how to plan for the problem that are relevant to your scenario. So the aim of care is to relieve suffering, adopt a holistic centered approach. You want to relieve pain, you want to provide solace and comfort to the patients, family, and carers. So we have the scenario taken from the assessment. James presented with history of chest pain, shortness of breath, reduced mobility and collapse. Prognosis is less than 6 months. Diagnosed with multiple organ failure, got a past medical history of heart failure, chronic kidney disease, stage 4, COPD, has a DNAR in order in place. James has been admitted into the frailty ward with collapse, chest pain, and was diagnosed with multiple organ failure, queried cause. Is awaiting a review by the palliative team. Now, you are expected to produce nursing care plan for two relevant aspects of care suitable for the next 24 hours. Assume it is today, it is 12 hour. Your plan of care needs to be individualized based on the scenario. So there are a lot of problems that we can face or handle when we have end of life. So these are some of the suggestive problems. We can say Jane is experiencing shortness of breath with a respiratory rate of 26. Jay is experiencing pain with a pain score of 6 over 10. Jay is having anxiety related to prognosis of disease condition. Jay is experiencing constipation due to regular use of opioid and anticipatory medications, if that is related to your scenario. Sometimes Jay might be experiencing nausea and vomiting as well. J is at risk of malnutrition related to disease condition. J is at risk of fall. These are the likely problems we might be faced with. So we'll just solve two of those problems. So the first one we're going to solve is J is experiencing difficulty in breathing with a respiratory rate of 26. How did I get the respiratory rate of 26? This was from the assessment. So please have a look at the assessment station. My aim of care is to relieve J of his difficulty in breathing or to relieve J of his shortness of breath. Anyone is fine. My reevaluation to be reevaluated today, the date of my exam, for example, 23/12/24, every 1 hourly or as soon as clinical condition changes. It's an inpatient scenario, hospital setting, and this is something that is life threatening, even though it is end of life, but still, we still have to do the necessary intervention. Yeah, we want to follow a matter to make it simple. Explain, gain consent from J for all aspects of care. Then the M, monitor J's full set of observation and escalate as per news policy. Assess J's respiratory rate, depth, and pattern. Yeah, teach James deep breathing exercise. Administer J's prescribed medication. Monitor for effectiveness and side effects. Refer J to the respiratory team for further plan of care. Instruct J on the use of call bell because it's an hospital setting. D, document all aspects of care given to James. Sign, dates, and print your name. And this should even be the first thing to do. So the second nursing problem we're going to address is J is experiencing pain with a pain score of 6 over 10. Where do we get the pain score? From the assessment station. The aim is to relieve J of his pain to a level he can tolerate. And for some candidates, they may want to put the level they want to reduce the pain. For example, to relieve J's pain to to a pain score of 2 to 4. So it depends, but you don't. It's not compulsory to put the level you want to reduce it to. But if you say you want to reduce the pain to a level you can tolerate, is fine. And if you want to go with the range you want to reduce it to, is equally acceptable. So my reevaluation date will be to be reevaluated today, the date of my exam, 23/12/24, because it is pain every 1 hourly or as soon as clinical condition changes. We want to follow a matter to make it simple. E. Explain, discuss, and gain consent from all for all aspects of care from J. Monitor J's full set of observation every 1 hourly. Where did I get the 1 hourly from? From my assessment station. And escalate as per news 2 policy. Yeah. Assess J levels of pain using the universal pain scale tool. You want to teach Jay diversional therapy of his choice, watching films, listening to music, or even deep breathing exercise, repositioning, depending on the location of the pain. Administer J's prescribed medication, monitor for effectiveness and side effects. And if you want to put the class of the medication, then you have to put the timing that you're going to monitor. So, for example, some candidates might go for administer J's prescribed analgesic, then monitor for effectiveness and side effect after 30 minutes. Refer J to the palliative team / the pain management team for further plan of care. Instruct J on the use of call bell in case in need of help, because this is an hospital setting. Document all care given to J. Print my name, sign, and put the date. Yeah, that's your end of life planning station. Wishing you all the best. Thank you.